Pegunigalsidase Alfa-Iwxj 2 mg per milliliter intravenous solution is used to treat Fabry disease, an inherited disorder that causes the buildup of a certain fat substance, GB3, in the body. If left untreated, this condition can lead to kidney disease, heart attack, or stroke. This medication works by replacing the enzyme that the body lacks, helping to break down the fat substance GB3. This can help reduce the buildup of GB3 in the kidneys and blood. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. This medication is administered through a slow injection into a vein, typically every 2 weeks, as directed by your doctor. The dosage will be determined based on your medical condition, weight, and how you respond to the treatment. To help prevent a reaction during the injection, your doctor may prescribe other medications, such as acetaminophen, antihistamines, or corticosteroids. It's important to carefully follow your doctor's directions for using all your medications. If you experience any symptoms during the injection, such as chills, flushing, itching, nausea, or muscle pain, be sure to inform your doctor right away. Your doctor may need to adjust the injection or provide additional medications. If you will be using this medication at home, it's important to learn all the preparation and usage instructions provided in the product package and from your healthcare professional. If anything is unclear, make sure to consult your doctor or pharmacist. Before mixing the medication, be sure to allow it to warm to room temperature and avoid shaking the mixed drug, as this can affect its effectiveness. Using this medication regularly is important to get the most benefit from it. You may find it helpful to mark your calendar with the dates for each dose. It's important to inform your doctor if your condition does not improve or if it worsens. If you experience any injection reactions such as pain at the injection site, diarrhea, stomach pain, tiredness, back pain, nerve pain, or cold symptoms like a runny or stuffy nose and cough, it's important to let your doctor or pharmacist know. It's also important to remember that the benefits of this medication outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. And if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA, and in Canada, you can report them to Health Canada. During or after the infusion of Pegunigalsidase Alfa-Iwxj 2 mg per milliliter intravenous solution, you may experience serious allergic reactions, which can sometimes be fatal. A healthcare professional will closely monitor you during and after the infusion. If you notice any signs of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, shivering, headache, trouble breathing, or chest pain, seek medical help immediately. Your doctor may prescribe other medications to treat these side effects, such as antihistamines or corticosteroids. Depending on your symptoms, your infusion may also be slowed down or stopped. Before starting Pegunigalsidase Alpha, make sure to inform your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. Also, be sure to tell your doctor or pharmacist about any previous enzyme replacement therapy you have undergone. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications and products you are using. If you are pregnant, consult your doctor before using this medication, as it is unknown whether it passes into breast milk. It's important to be aware that Pegunigalsidase Alfa-Iwxj 2 mg per milliliter intravenous solution may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much Pegunigalsidase Alfa-Iwxj 2 mg per milliliter intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center for assistance. During your treatment with Pegunigalsidase Alfa-Iwxj intravenous solution, your healthcare provider may conduct lab tests or medical exams to monitor your condition. It's important to attend all scheduled appointments to ensure the effectiveness and safety of your treatment. Make sure to take each dose of Pegunigalsidase Alfa-Iwxj 2 mg per milliliter intravenous solution as prescribed by your doctor. Do not take an extra dose to compensate for a missed one. If you happen to miss a dose, consult your doctor or pharmacist immediately to establish a new dosing schedule. When storing Pegunigalsidase Alfa-Iwxj 2 mg per milliliter intravenous solution, it should be kept in the refrigerator, but do not freeze it. Once removed from the refrigerator, the mixed drug should be used within 8 hours and any unused portion should be discarded. It's important to keep all medications away from children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.